If you've recovered from COVID and now have antibodies, should you still get vaccinated? It's just one of many questions the Creme 2 Verify team is working to answer. So here's what the experts and the data both say. Let's start with the question. Glenn writes, my wife and I both had COVID and we tested positive for 7 weeks. Finally, we both tested negative, and a week later, the good news is we both tested positive for antibodies. Is it recommended we still get the vaccine if we're still positive with the antibodies? To answer this question, we turn to the Centers for Disease Control and Prevention and Dr. Pyle Coley, a cardiologist and medical expert for our sister station in Denver. Is it recommended that we still get the vaccine if we're still positive with the antibodies?
So it is recommended for individuals who've had COVID, recovered, and may have antibodies to still go on and get the vaccine.
The CDC also addresses this question in a post titled, I've already had COVID, should I still get vaccinated? The answer, yes, due to the severe health risks associated with COVID and the fact that reinfection is possible, you should be vaccinated regardless of whether you've already had the virus. But the CDC adds the caveat, if you were treated for COVID symptoms with monoclonal antibodies or convalescent plasma, you should wait 90 days before getting a COVID vaccine, and that people should talk to their doctor if they're not sure what treatment they've received. Dr. Coley explains why.
Because having those synthetic antibodies or having convalescent plasma can actually reduce the efficacy of the vaccine because it basically stops the vaccine from working before it even gets started.
Dr. Coley also points out that so far the data shows vaccine-induced immunity from the Pfizer and Moderna vaccines seems to last longer than natural immunity. But back to the original question, should someone who tests positive for antibodies get vaccinated? We can verify that yes, they should. And do you have something you'd like me to verify? Give me a call at that number on your screen and I'll work to answer your questions.